Well, hello and welcome to the 27th Degree with Chris and Nancy. We are very excited to have Dr. Christopher Vanderpool on the podcast today to discuss dentistry and dental health. But before we begin our conversation, I'd like to thank our sponsor, Bay Coast Bank. Bay Coast Bank is just right for all of your financial needs. Visit baycoast.bank or call 508-678-7641 to learn more. As always, you can support the 27 Degree with Chris and Nancy by subscribing to us on YouTube or your favorite podcast platform, and by following us on Facebook and Instagram. Also, please remember to leave a review, and of course, 5-star reviews are greatly appreciated. So, Dr. Vanderpool, tell us a little bit about yourself, your background, and how you got into dentistry.
Yeah, perfect. Well, first, thanks for having me. So I'm a Florida boy. There's not too many of us up here. So I grew up in Florida, went to college at Florida State. Decided on dentistry my last year of college, so had a little bit of time between college and dental school to get the applications going and take the exams and all that good stuff. So I found myself trying to find something to do for a year, so spent a year teaching chemistry and physics in high school. I know. And then, so did that for a year, got into University of Maryland for dental school, spent 4 years down in lovely Baltimore, and then ended up in Providence for a residency program at the VA hospital. Like a general practice residency. Got to treat a lot of awesome veterans, and then basically been in the area since then. So I've been in Somerset, Mass since 2015 in private practice.
Now, you just opened up a really nice office in Somerset too, right on County Street.
Yeah, it's funny. Yeah, we so I bought that practice in 2015, and when I bought it, there wasn't good signage or anything like that, and kind of grew it, fixed it up a little bit, and then we did a big expansion last year and just really everything down to the studs and just built like a really nice facility we could be proud of. And
gorgeous.
Nice.
You know, when you're somewhere for 8 hours a day, 5 days a week, it helps when you like where you go to work. So
Good.
So I'm going to come clean with everyone and say that Dr. Vanderpool is my dentist, and I just recently switched, and I was nervous about switching because I had gone to my family dentist for like 20 years. But you were right in Somerset, very convenient, parking was great. And it's, when you walk into the place and you can just pick up on the culture, it's really nice. The girls are really friendly, and your dental hygienists don't hurt. And I said, how come you didn't hurt?
I don't think they should hurt you.
Well, but some do, right? And she's like, it's our philosophy here. I was like, yes. Thank you.
Well, that's great. I'll pass on the kind words.
That's great. So Florida State, isn't that where Gatorade came from?
Oh, boo.
That's bad for your teeth.
Yeah,
Right?
terrible for your teeth. Yeah, that's actually University of Florida. So
it's University of
Florida. Yeah. So
Okay.
yeah, we're the Seminoles. They're the Gators, which is the Gatorade. So yes, totally different university. So yes,
I knew it was Florida.
Yeah.
I knew that
Yeah,
much.
you're in the ballpark.
Yeah.
So to open up the conversation, what are some of the general guidelines people should be following about dental health, like brushing your teeth and flossing and specific toothbrushes and when to change your toothbrush, all that good stuff?
Yeah, absolutely. So get this question every day. So I'm very happy to field it. In general, 2 times a day for brushing your teeth is perfect. Flossing once a day, ideally at night, is what we like to see. As far
Floss
as
before or after you brush?
So doesn't really matter. I'm an after guy,
Okay.
to be honest with you. Some people, they argue if you floss before, you'll just kind of brush the stuff back into your teeth. So I'm a floss after guy, and then I use like a mouth rinse after that. But to be honest with you, though, I can't tell you how many of my patients do not floss on a regular basis that I'm not going to get so picky about when you do it. I just want you to do it. But yeah, ideally twice a day, flossing, ideally at night. I'm kind of a big stickler as far as flossing at night.
Yeah.
And the reason behind that is, at nighttime, your salivary flow really decreases, and you just want to get all that stuff out that's been building up during the day out before you go to bed at night. Because at nighttime, your salivary flow decreases. That's your main protectant against tooth decay. So if anything's sitting there at night, just kind of caked on your teeth, your salivary flow decreases. It just it just really gets caked on your teeth. Like I said, I'm not gonna. If somebody's like, I'm only gonna do it in the morning, like, I'm not gonna kick you out of my office.
Oh my God, no.
But yeah, ideally at nighttime. And yeah, as far as toothbrush are concerned, I'm a huge fan of the power toothbrush.
Yeah, why?
So it the biggest thing is it makes brushing more of like a systematic routine.
Mhm.
It's not so much like the power versus the manual.
Yeah, yeah.
It's more, these brushes are designed like they vibrate for 2 minutes. So like, you're going to stop when the brush stops versus like when you have your own brush in your hand, you're just kind of like, most people just kind of haphazardly just kind of go to town,
Right.
and they might think they're brushing for 2 minutes, but it's like 30 seconds.
Yeah.
And then also most of
that.
them have like a little built-in, like an extra little chirp or vibrate
Mhm.
every 30 seconds, kind of reminding you to go from like quadrant to
Pretty
quadrant,
fancy.
which is nice too. So, I tell my patients like 2 minutes, ideally 30 seconds per quadrant. You really just kind of want to make it like very systematized, like more quality over quantity. So yeah, I mean, it can be super duper simple, but it's one of those things, like most things. I mean, as humans, we all have kind of a monkey brain, and we just like,
That's
so
so
we
true.
need to make things as simple as possible. And once they're kind of
Right.
habitual routine, it's like,
Yeah.
it is what it is. So
Can you brush too long or brush too hard? Can that be damaging?
too long, no, not really. I mean, I guess with, everything in moderation, right?
Right.
But you can definitely brush too hard for sure.
Huh.
You can brush too hard. You can actually floss too hard if
Mm.
that's a thing.
Hmm.
So yeah, you can, especially they make toothbrushes with soft bristles, medium bristles, hard bristles.
Yeah, what's the
Right.
deal with that?
So really, everybody should be using a soft bristle brush.
Okay.
The medium hard bristle, that's really just kind of a marketing thing by the toothbrush companies. So soft bristled's more than enough. You don't need to apply a lot of pressure. But some patients, especially with the manual toothbrushes, can really go to town and cause recession of gum tissue. They can cause like notching of once the gum tissue recedes, the root surface becomes exposed, and notching
Oh,
of that, sensitivity. I mean,
Right.
lots of kind of bad things can come from brushing too hard.
right. So when you're flossing, is it, like the regular flosses that you're pulling out versus
Mhm.
like the little flossies? Is there anything like any pros and cons to either
What are
type?
the little flossies?
Like the little things that look like like that thing, and it has like the little.
Yeah, I
It's
know
like
what
a
you're
little.
talking
It's like a little
Are you
hacksaw.
Yeah, yeah, like a
kidding me?
hacksaw.
Yeah, it's like a hacksaw.
It's like a hacksaw.
Yeah.
Okay, he knew what I was talking
Yeah.
about.
So yes, another thing, a lot of my patients I think they're called like floss picks. I think
Okay.
is what they're branded as. It's one of those things. If that's the only way you're going to floss, I'm not going to tell you not to use them.
Right.
Now, where they fall short, and it's kind of hard to do this without a diagram, but when you floss, you're not just kind of going right down between the teeth. You're kind of supposed to
Right.
go down and kind of hug the tooth, kind of
Yeah.
down to the pocket that surrounds the tooth.
Right.
And those floss picks make it very difficult to do that. You kind of can
Yeah.
only just go up and down. So it does a
Right.
good job of getting the junk
Gunk.
out
Yeah.
right between the teeth. It doesn't do a great job of kind of getting down
Like really
into those
clean.
pockets in the gum tissue. So once again, I tell patients, if this is the only way we're going to get you to floss, then by all
Go for
means, go for it. But, ideally, you got like the traditional floss, you're kind of hugging the tooth and doing that whole thing.
Now, if someone hasn't, if they're not like a legit flosser and they want to start paying attention to it, they might see some bleeding for a little while, right? Does that go away?
Absolutely. So yeah, so when you first, if you haven't been flossing for a while, it's kind of like if you haven't gone to the gym for a while, you start lifting weights, you get kind of sore initially.
Yes.
That's your body's reaction. And your body, that's lactic acid.
Okay.
Your gum tissue, it's inflammation. It's
Okay.
it's your body telling you, yeah, it hurts right now. Like, you're doing something right. And as you do it more often, your tissue is going to go from red and puffy and bleeding to kind of pink and healthy. It's going to get a little firmer to the tooth.
So everyone
Okay.
that says, yeah, I floss all the time, they did it before they went into the dentist's
Right.
office, you're onto them.
I'm onto them. Yeah. And I was that guy. I was that guy as a teenager. So, I mean, I haven't been the epitome of dental health my whole life. So,
Now, are there certain foods like you definitely want to stay away from?
oof, that's a loaded question.
Like Oreos.
There are worse things than Oreos.
How about acidic foods? Like
So yeah, acidic
lemon,
foods are
that.
yeah. So it's lemon if it's going to be just something like lemon and a little bit of water,
Yeah.
maybe. If you have that, you're not just sipping it throughout the day. You're probably safe.
Mhm.
If you're going to sit there and you're just going to sip lemon water all day, you're going to do some damage. So when I'm looking at patients, especially we'll take a step back here and we're talking about cavities.
Mhm.
Okay. So when you're talking about cavities, it really comes down to sugar and acid. Those are the two things that are kind of,
Okay.
it's more than just sugar. It's just any simple carbohydrates So it could be white bread, white rice,
So those are
goldfish,
things that
crackers.
I wouldn't associate with like this is bad for my teeth, piece of
Right.
white bread.
Right.
Like yeah, you think like all that, like
Yeah.
the Oreos, the tea.
Swedish fish, Mountain Dew. And of course those things are terrible for your teeth, but most people know that, and if they're doing that, they kind of know they're doing something bad. And
Yeah.
as a dentist, I don't want to make them feel terrible about the
Right.
things they already know they're doing bad. I mean, as a physician, you probably play that game with patients all the time too. You don't want them feeling worse leaving your office when they came in.
Right.
So I try to educate the patients on things that they might be doing that they have no clue is doing damage. So we're talking about acid and sugars. And the funny thing is, it's not necessarily how much of it you're having, it's how often you're having it. So the frequency is far more important. Like the frequency of the sugar and the acid is far more important than how much of it you're having.
Oh my God.
So if you're like a big thing around here in Florida, like Dunkin' Donut iced coffee,
Yeah.
not really that big of a thing. In New
Really?
England,
It's all
like
the time.
all the time. So I get patients that come in, they might
Bring their
have,
drink
might have a
with
lot of
them.
cavities, bring their drink with them, stick it down there, it's extra. And I said, and it's 2:00 in the afternoon, and they might have a lot of cavities, and we start talking about, so what do you drink throughout the day? And I have a coffee. Well, do you have it like 15, 20 minutes when you first get up, or is it something you kind of sip throughout the entire day? Oh, and they point to the one they've been sipping on all day long. And what happens is your mouth is just constantly under an acidic attack from that coffee and the sugar you're consuming throughout the entire day.
That makes sense.
Like it's very, it's when the pH of your mouth gets below 5.5, that's kind of a little scientific here, but basically the bacteria in your mouth eats the sugar and it digests it, produces acid as a byproduct, and the acid dissolves its tooth. That's kind of how the process works. So if the bacteria in your mouth is just constantly just munching on sugar all day, it's producing acid, the pH goes down. Once it gets below that 5.5, the tooth starts dissolving. So you do this all day, every day, we're going to have some problems. So it's simple carbohydrates and sugars, acid, like I said, a little bit of lemon water. You want to have it with a meal, you're going to be fine.
Yeah.
You're going to just sip it throughout the day.
That's
you
a
could
different
have some
story.
problems. It's a different story.
I mean, you can't really eradicate all the bacteria in your mouth, but things like mouthwashes and that, does that help to limit tooth decay?
Mouthwashes, not so much. So some of the mouthwashes will have fluoride in it, which is which is protective against tooth decay. So not all bacteria in your mouth is created equal. Some patients the bacteria in their mouth is heavily skewed towards the cavity-causing bacteria, and maybe not so skewed towards the bacteria that causes gum disease. Other patients, exactly the opposite. And so it's not impossible, but it's very uncommon that you'll see a patient who has a mouthful of cavities and also rampant gum disease, or what we call periodontal disease, where you're losing the bone that supports the tooth. And the reason why, it's kind of like a seesaw, it's kind of like this or like this. So we have patients that come in and they say, hey, they're ticked off because their brother never brushes his teeth, drinks Mountain Dew all day, never has a cavity. And
That's my son.
And then the other brother, looks at a soda and just decay everywhere. It's like, how could that possibly be? Well, the guy who doesn't get cavities, he might have bone loss around his teeth. He has gum disease, but he doesn't have cavities, and his brother is exactly the opposite. So these are all kind of genetic things you kind of get from your parents. So just like when a physician sees a patient, starts talking about cardiovascular disease, cancer, that kind of stuff. Same kind of thing happens in the dental office too.
There's certain things like you really look for at certain stages of a person's life. Like when you see a kid, are you like kind of checking out, and do they have different like risks that you're assessing for than a young middle-aged person like me versus an old middle-aged person like Chris?
Nice.
Versus like a granddaddy.
Not there yet.
So yeah, I mean, in every stage of life, there's certain things we have control over that are more pertinent. Certainly, like in kids, they're undergoing a lot of growth and development at that age. So from like an orthodontic standpoint, we can do a lot more for them
Right.
while they're in that growth and development period. So we're kind of assessing kind of the way their teeth are lined up. Once you get to be sort of like adolescent or post-adolescent and adult, your jaws aren't growing anymore. So if you
Yeah.
have some serious issues as far as the way your teeth are lined up, that can be virtually impossible to fix without doing some pretty invasive surgery.
Right.
Versus if you kind of can look at these things early on. So those are things we focus on kind of in our younger patients. Certainly with our like very young patients. I mean, we see some patients at our office that are like 1 or 2 years old.
When should people start going to you? How old?
So I tell parents, and the American Academy of Pediatric Dentistry kind of backs this up too. They say when they get their first tooth or by the age of 1.
Oh,
Now people hear that and they cringe. They go, "I'm not bringing my 1-year-old to the dentist." Like I said, like we're not going to be poking their
taking out
gun.
the drill.
We're not taking the drill out. We're not poking anything. I mean, you're literally going for a ride in the chair with mom or dad. And honestly, who's getting the treatment that time is mom or dad. We're spending time going over, diet, oral hygiene instructions, those kinds of things. Because there's a lot of things that, parents might be doing that they think is in their child's best interests.
Right.
But it could just totally wreak havoc on their dental health.
does insurance cover a child? Like, does insurance have different rules for like what's reimbursable and what's
So,
not?
Let me preface this by saying I am no expert on insurance. I try
There's
to
so
know.
many
I
out
try to know
there.
enough to be
Right.
dangerous
right,
about it, so I can kind of help the patients kind of navigate it.
Right.
But most patients do have coverage. The Affordable Care Act made
Okay.
basically a pediatric dental benefit
Okay.
almost like a requirement.
Okay.
So even myself, like I was required to have dental insurance for my kids, and
Yeah.
even though I'm a dentist,
Yeah.
which seems kind of silly, but it is what it is. So yeah, between that and like the state's mass health program,
Yeah.
virtually every child should have some sort of coverage for dental benefits.
Nice. So then what happens? What are you looking for like in middle age versus like really old age?
Yeah. So I think when let's take a step back here, and we'll go from the kids, and then we'll kind of work our way up to maybe we'll go before middle age, like early adulthood.
Okay.
So things we're looking for. Obviously, we talked about cavities. We've talked about gum disease. I mean,
Yeah.
these are kind of the obvious things. Now, there's some less obvious things we sort of look at that I'll sort of bring up with patients and find out if it's. We take a lot of photos in our office because nobody, when you look at a photo on a
Right.
screen, it just makes a
Right.
lot more sense. And you're
course.
kind of explaining or giving them a mirror, and it's
Yeah.
dark in there. And one of the big things with early adults we're seeing is a lot of tooth wear.
Okay.
So maybe teeth that are 10 or 20% shorter than they were when they erupted inside their mouth. And at that point, they're kind of on a slippery slope. You say, patient might be 25 years old and they've already lost 20% of the length of their tooth.
That's
Maybe they have no cavities, they have no gum disease. But I say, look, like you're 20 years old. Like, how old do you think you're going to live to? I was like, yeah, 90, 100 years old. Who knows what modern medicine is going to be able to do for these people. And you've lost 20% of your tooth by the age of 25. Let's kind of forecast 30,
Right.
40, 50 years down the road. And even if you don't have a single cavity or you have no gum disease, let's kind of forecast what this is going to look like if this tooth wear keeps progressing.
So why do they develop it? Are they grinding their teeth? Are they clenching down too hard? What's the
So clenching and grinding, it is it's ubiquitous. I don't. There's no studies out there saying what percentage of the population actually does it. It's a hard thing to kind of measure on a population-wide scale.
Right.
I firmly believe we all do it.
Mhm.
Some people do it every night. Some people it kind of oscillates based on what kind of stressors are going on in their life.
Mhm.
Patients that have obstructive sleep apnea, which I'm sure we'll touch on, that is one of the hallmark dental signs of somebody who might have untreated obstructive sleep apnea is really heavy tooth wear.
Huh.
So those are things we're kind of looking at that point. Now, the thing about tooth wear is there's not a lot we can do to get the patient to actually stop grinding their teeth. I mean, there's no short of prescribing them like a muscle relaxer, which has a lot of not so nice side effects.
Very sedating.
Really it's a protective thing, like a night guard. Can be
Yeah, I was
super
gonna say, I
beneficial.
guess, huh?
Yeah, and with that, it's the toughest part about that is once again just getting the patient to kind of see the value in it, and then actually wearing the thing every night when they go to bed.
Mm.
And I have models of them in my office showing them like how small and sleek they really are. I think people picture it's like this big,
Right.
like football, like
Yeah.
like some
Right.
karate night guard that they would wear,
Yeah.
mouth guard they
Not
would wear
so
playing
much.
hockey. Not so much. They're very thin, and they just kind of, it's a piece of acrylic that goes between the teeth, and it's kind of like, tell patients, like when you bite down, it's kind of like now your teeth are like skating on ice. It's nice and smooth. Teeth are never coming into tooth contact, and so that's something we look at patients kind of early adulthood into their later years. I mean, obviously, if somebody's in their 90s, they have tooth wear. I mean, I'm not going to tell that guy he needs to get a night guard.
Right.
But as you get older, certainly, I think the big thing is patients get older as they start losing teeth for whatever reason. Talking to them about the pros and cons of like replacing the teeth, and that's kind of because most patients will, when you lose a tooth or two, you adapt.
Right.
You know, your life's not going to change that much. But 1 or 2 teeth turns into 3 or 4 teeth, and all of a sudden you've got your chewing muscles are exerting the same amount of force on 20 to 30% less teeth. It's just going to accelerate that tooth loss.
Right.
It's going to accelerate the likelihood of patients breaking, splitting, cracking teeth, further losing teeth going forward. So it just makes that, you know, I've had patients with no teeth say they can eat, chew, drink whatever they want, but that's,
Not a steak.
you know, not a steak. Exactly. They say they can do it,
Huh?
but I'm like, okay.
Yeah, I'd like to know how that works.
Yeah, I don't know how that works either.
Yeah.
But I would say as patients get older, just, you know, if they start losing teeth, kind of just going over the pros and cons of that and kind of what that looks like, and walking them through like what, if we don't do this, what that could mean for you later on.
So when you talk about patients having like cracked teeth, or their teeth getting cracked, or just kind of biodegrading, I guess, I don't know. How come that happens? Is that just strictly old age, or are just some people's teeth stronger, or do some people have better habits that will strengthen the tooth or keep it strong?
Well, aside from some relatively uncommon developmental things with like
Right.
the enamel of the tooth, nobody's tooth is like, you know, other than those people, most people, the strength of your teeth are the same.
Okay.
Your enamel's the same.
Okay.
A lot of it comes down to you know, if you're clenching and grinding, you know,
Okay.
what sort of force you have, you know,
Okay.
how strong these masseter muscles are right here. You
Mhm.
see somebody that have a very square jaw,
Yeah.
almost like a shorter face.
Yeah.
They're really wound up.
Ah.
Patients have a little bit of a longer jaw. You know, it's not quite as
Oh.
much force there. So that's something. The other thing is, you know, depending if you've had fillings on your teeth, you know, anytime we do a filling on a tooth, we're getting rid of the pathology that's there. We're getting rid of the cavity.
Right.
We're making the tooth weaker. You
That
know,
makes
so
sense.
there's nothing, and I don't mean this in a really a biblical sense, but like nothing's as good as what God gave you.
Right.
And when you go in and work on it, you're inherently creating some weakness inside the tooth.
Right.
So if you have a tooth that has a really big filling on it, that tooth's going to be more prone to breaking down.
Okay.
So if you take somebody who's got a really hard bite and they have a big filling, there's a really high chance they're going to break that tooth. They're going to crack that tooth.
That makes sense.
So
So let's talk about the cavities and the fillings for a minute. If you're like, I have fillings, and they're the silver
Mhm.
fillings. There had been, like, I hear every so often, oh, you should get those taken out. There, I don't know what will
Right.
do to me, but
right.
you know, and have them replaced. Is that like, what are your thoughts with older fillings?
Yeah. So that's, I mean, I could
It's
get a
kinda
lot. I could get,
controversial,
yeah,
right?
it could be a little controversial.
Yeah.
So,
Well, what are the two trains of thoughts?
yeah. So there's a train of thought. There are a group of dentists out there that believe that the old silver mercury fillings are toxic, and if you leave them in there, you could develop chronic conditions and MS and Alzheimer's and cancer, and you know, a lot of things are thrown out there.
That could
Right.
explain a lot with you,
Yeah.
Oh my God, you're so evil. Go
I
ahead.
think the research
All that
surrounding
mercury
that is
toxicity.
pretty shaky at best.
Yeah.
So I'm not a huge proponent of doing that. I've had some patients, and they absolutely insist on it, and I'm not
Yeah.
gonna, you know, like, I'm not gonna say
course.
no. You know, as long as they know the pros and cons, I can, you know, I can do that in select cases. Now, as far as old fillings, I mean, sometimes old fillings that are totally asymptomatic to the patient need to be
Right.
replaced. You know, there could be these like little stress cracks that are forming that
Yeah.
the patient is like an olive pit away from breaking the tooth.
Right.
And you know, take a picture of it, and take a picture, it makes a lot more sense. But say, hey doc, the tooth doesn't bother me, and you know, so there are times where like an old filling, it's cracked or it's leaking,
go.
there's decay around it, there's time to have those replaced.
Yeah.
But by and large, it's a good material. I think personally for me, it's more of like an environmental thing at this point. Like when you have to drill and remove those, I think
Yeah.
and we have things in our office that we're required to have to kind of separate that before it goes into the public
Right.
sewage system.
Yeah.
But still, you got to think that some of that stuff's still kind of floating
Right.
out there. And I just think environmentally, maybe I'm a
Yeah.
little bit of a hippie, but I'm not, super thrilled about all that stuff just kind of going out there.
Yeah,
So,
Of course.
so we don't really place that material anymore, but I'm not a huge fan of just replacing it because it's in somebody's mouth.
What do you use for fillings now?
We use a material, it's called composite resin. It's basically like a biocompatible kind of plastic material, essentially. It's BPA free, so if people are concerned about BPA, it's BPA free material. It's chemically bonded to the tooth, so it's a lot stronger than the silver fillings.
Right.
Yeah, it's a good material. We'd be a lot more conservative. We don't have to make the hole quite as big in the tooth because it is.
Nice.
When you did the silver fillings, they had to be really
Yeah.
big,
Right.
kind of like wedged them in there.
Yeah. Yeah.
And the composite fillings, you kind of just remove the pathology, the decay, place the filling, and you're good to go.
Oh,
That's great.
Sweet.
Yeah.
So then I want to back up just a little bit because we covered some of the ground rules, if you will, for good dental health. But can we just go back and talk a little bit about toothpaste and type of toothpaste? Not so much name brands, but are we looking for anything in particular?
Doesn't matter.
Or if
All
it
of
has
that.
baking
Yeah.
soda in it, or if it's like
Yeah.
total
Right.
versus like a regular toothpaste. And
So in general, I think a fluoride toothpaste is a good practice for everybody.
Okay.
I think starting there is like just bare bones. I think when you stray from there, a lot of it kind of comes down to personal preference, and I don't really care what you use. There are patients of mine, I won't say the brand, but there's a particular brand of toothpaste out there, and patients they'll have like kind of a pretty significant, I wouldn't say an allergic reaction, but like a hypersensitivity to it where their
Okay.
gum tissue will almost like slough off.
oof.
So like maybe like 2 to 3 times a month, a patient will call for like an emergency exam, and
Yeah.
the receptionist will say, patient's gum tissue sloughing off, and I know 9 times out of 10 what's causing it. And so, didn't do any irreversible damage to that patient, but just kind of finding what works for you as far as like a taste, how abrasive it is. Is it, like I said, fluoride's a good practice for most patients because it is anti-cavity.
Right.
Now there are some patients out there, if you're in your middle age, you've never had a cavity your entire life, you might not need fluoride in your toothpaste. You might be such a low risk for getting cavities. Your diet is just so excellent that the fluoride isn't really doing you much benefit.
Right.
Now, with that said, there is a certain subset of patients out there who are very anti-fluoride. And I kind of always stress that like the fluoride in the toothpaste, it's really just, it's topically being applied to your tooth. I mean, let's be very, very clear. I'm not suggesting we like ingest a huge amount of fluoride
Right.
to reduce tooth decay. I think a topical fluoride, it's safe and it's effective.
We're getting fluoride in water in most areas
Yeah,
also.
Exactly. In most areas, I mean, unless you're on well water or you're in
Yeah.
like a very, very rural community, most communities, you're getting fluoride in your water as well.
So you can really see the difference in areas where they don't fluoridate the water, how much dental decay there is.
You can, absolutely.
It's really interesting.
Right. Unfortunately, though, I think nowadays we're seeing, as we sort of alluded to a little bit earlier, some of the beverages we're drinking nowadays are sort of offsetting that. So
Right.
the energy drinks, especially the iced coffees, kind of sip throughout the day. So you're kind
Right.
of seeing it kind of go back into seeing a lot more tooth decay. It's
Right.
all anecdotal from my
Right.
perspective, but I just feel like lately we've just been. Like
I'm a
just-
big Crystal Light fan, so I
Oh,
have to
boy.
cut back on that. I know I have like at least like 2 packets a day.
Yeah.
Well, can I give you a tip though? If you
Yes.
if you're not gonna, you just find it impossible to curb your Crystal Light. So obviously that would be the most ideal thing to do. But for patients that for whatever reason it's just like this is their
They need
vice.
the
This
fix.
is their vice.
Mm-hmm.
What I would suggest is have your Crystal Light, but also just have a big bottle of water with you too, and just do
Oh.
like a sip of Crystal Light, sip of water.
There you go.
That's going to kind of help buffer the acid that's being
Okay.
formed there, kind of help wash it off
Okay.
your teeth.
I can do that.
Might be a little just, something like I'm a coffee drinker. So I get it.
Primacare is Southeastern New England's trusted leader in medical care. With offices in Fall River and surrounding communities, we're dedicated to your well-being. Our carefully selected team of more than 150 providers offers world-class primary and specialty medical care. Primacare doctors are supported by a skilled staff trained to deliver comprehensive radiology, imaging, and testing services. Primacare is large enough to take care of all your medical needs, but small enough to care for you personally. Primacare is by your side.
How about baking soda in your toothpaste? Does that matter?
Not really.
Okay.
Yeah, it's sort of abrasive.
Oh.
But for some patients, if you have like a lot of stain on your teeth, and if it's not causing any adverse reactions to your gum tissue, you're not getting any recession, it's just fine.
How about whitening toothpaste? That always seems like it'd be bad for your teeth. I don't know.
Yeah, like I said, everything in moderation. The whitening toothpaste per se, once again, most of them they're just more abrasive.
Okay.
That's really all they are. There's actually generally no, like the same stuff we have like in white strips or the whitening we do in the office. It's they don't put that in the toothpaste. So when they say like a whitening toothpaste, I always wonder like what they're putting in there. And I've tried them myself. They're just more abrasive.
That's
so
all
they're
it
just getting
is.
the stain off the teeth.
That's
all.
interesting.
Yeah.
And then you have, I'm trying to think of other options out there. There's so many different types of toothpaste and whatnot out there that people use. Oh, the ones for sensitive teeth, like Sensodyne and that. I would think if you have sensitive teeth, you probably need to see a dentist rather than use Sensodyne. And those types of things.
Sensodyne can be very effective.
Okay.
So I would say, yeah, you should probably be seeing a dentist every 6 months
Right.
anyways, because the sensitivity might not be. So let's take a step back here and talk about what can cause sensitive teeth. It could be as simple as you have a little bit of gum recession,
Okay.
and that's like the most straightforward, mild kind of patients are happy to hear that news because it generally means they don't need a filling.
So what's sensitive on your tooth? Like what part of the tooth? Like if cold water is really bothering me, like what's happening on my tooth?
Right. So you have the enamel of your tooth, which is like,
Right.
I guess the best way to describe it, think of your tooth like an M&M.
Okay.
Okay. So an M&M has a hard outer shell.
Yeah.
And the inside melts like chocolate.
Yeah.
Okay. Your tooth is exactly the same way. You have this hard outer shell. We call it
Okay.
enamel.
Okay.
And you have the inside of it called dentin.
Okay.
So when you have dentin on your root surface, so when your gum tissue recedes, all of a sudden you have exposed
okay.
dentin.
Oh.
And the dentin has these little microtubes that go to where the nerve of the tooth is.
Okay.
So if your gum tissue recedes, or if you wear away all of your enamel from clenching and grinding, or if you have what we call acid erosion, where you have a lot of gastric reflux at
Yeah.
night, which is very
That's interesting.
very common.
Yeah.
Very, very common, especially with sleep apnea patients, is they have a lot of what we call GERD, gastroesophageal reflux. And it'll basically melt the enamel away on their teeth. They'll have exposed dentin, and their teeth will get really, really sensitive.
And then having dry mouths at night too probably exacerbates it.
It exacerbates not so much tooth sensitivity per se, but the likelihood of getting tooth decay.
Yeah.
For sure. So, yeah. So to answer your question, it's that exposed dentin when the enamel wears away, or when your gum tissue recedes. That's what causes something to be super duper sensitive, and it doesn't take a lot. Some patients will have a lot of recession and virtually no sensitivity, and some patients will have like half a millimeter.
And
they'll come in and it's like 10 out of 10 pain.
Interesting.
So it's all over the map. Everybody perceives pain a little bit differently.
Of course.
So you're just a big wimp, basically.
That's
I am.
basically- yeah.
Like you nailed me. I am a big wimp, like 10 out of 10. I'll admit to that.
All right. Last question about toothpaste. These enamel restoring toothpaste, do they really do anything?
Marketing.
Marketing.
Yeah.
Okay. That's what I always figured.
It has
I'm trying to
fluoride.
think, how do you get
Yeah.
enamel back? You know,
Yeah.
once you lose it, you lose it, right?
It has fluoride in
That's
it.
such a chill answer.
Yeah.
Marketing.
It has fluoride in it, so you could just say
Yeah.
enamel restoring, but it's just all marketing.
It's all
Yeah, it's all marketing, yeah.
So the bottom line is basically fluoridated toothpaste are probably best, but they're all
Exactly.
fairly equivalent.
Right, yeah, for sure.
Yeah.
So I want to ask another question on the acid reflux stuff. If you have acid reflux, I've heard sometimes of like a brown spot on the tongue in the back, or like a hairy tongue, or is that part of the acid reflux progression? Like,
No, not so much. So we'll see that oftentimes in patients that have dry mouth,
Mm.
and if
okay.
they're depending on what their diet is and how
Mhm.
good their oral hygiene is, they could kind of be building up a lot of stuff on their
Mm.
tongue.
Okay.
So I don't talk a lot about tongue scraping with my patients,
Yeah.
but for those subset of patients, it could be really beneficial. Also, patients complain about bad breath. It
Mhm.
might be due to what you're describing here, or it could be something totally unrelated, like maybe untreated, gum, periodontal disease. Those particular types of conditions, the bacteria produces sulfur, which is not pleasant smelling. So yeah, so
Mhm.
it's kind of, you kind of have to take a little bit of a deep dive, kind of see what's going on. But as far as what you're describing, like getting a good tongue scraper might not be a bad idea either.
Yeah, people get a little freaked out by the black hairy tongue.
Yeah, it's not a good look. It's not a good look.
I have patients come in all the time with it. What's
Do
wrong with my tongue? And you look at it, they have black hairy tongue. Yeah.
like all over, or like a little spot in the back?
the whole thing.
The
Yeah.
whole thing.
Yeah.
Yeah, it's
And
probably
then you
not a
send it
good
my
idea.
way.
Yeah.
Like I didn't learn this in medical
I
school.
tell them, scrape your tongue and go to the dentist.
It's a good answer.
We talked quickly about something that I just want to bring to the forefront too. When people go for their dental appointments, it's not always to have like a problem fixed. It's really preventative. Like you were
Mhm.
saying, like you can pick up on something before I start to feel it, which is great.
Right.
Because I think people sometimes don't realize that if they're
Mhm.
not on that twice a year schedule, right?
Right.
Is what you recommend for visits and things like
Yeah,
that.
of course. Yeah, I mean it's just taking a proactive approach, and there's kind of analogies I like to use with my patients, and like I use one like high blood pressure.
Right.
Like nobody knows they have high blood pressure,
Right.
Until you
It's a great analogy.
have a cardiac event.
Right.
Right.
If you never went to the
Right.
doctor, you wouldn't know until you had a cardiac event. And it's the same way in our office. You wouldn't know you had gum disease until your teeth started to get loose and you
Right,
started getting
right.
abscesses, or your spouse told you your breath was terrible, or maybe she didn't tell you your breath was terrible. I mean, who knows?
Mm.
So yeah, it's all preventative in nature. When you take care of things before they bother you, it's less expensive and
Yeah.
it's less painful,
Yeah.
and the likelihood of you keeping your teeth is significantly higher.
Yeah. Dental implants are pretty expensive.
Dental implants are not cheap.
No.
So yeah,
It's crazy.
they're it's a pretty, and unfortunately, I wish it was like flat screen TVs that like if they
Right.
become more popular, the
Right.
price just like
Yeah.
plummeted.
Right.
But unfortunately, fortunately the price hasn't kept going up. I think it's sort of
Yeah.
stabilized.
Right.
But yeah, they're it's not an inexpensive venture to replace a tooth.
Yeah.
So,
Why is it so expensive for dental implants?
That's a great question. Because my dental friends and we always joke that as soon as somebody finds out we're a dentist, we get hit with the dental tax. Everything's like 20 to 30% more expensive, and we
Yeah.
pay more for a sterilizer than a physician's office does, and it's the
Oh.
Really?
same sterilizer. And if we try to
Crazy.
go to buy it through a medical supplier, as soon as they see us as dentists, it's like, I can't sell to you. It's the same. It's the
Interesting.
same thing.
I
So
didn't know that.
so yeah, there's some markup there, and it's just the way somebody above my pay grade knows the answer to that question. So
I'm always curious. I hear
Yeah.
patients, they come in, they say, they get this, they tell me how much it costs. And I was like, wow.
right. Well, there's like the single tooth implant, and
Mhm.
then there's patients that need total tooth replacement.
Right.
Right.
So I mean, single tooth implant, just ballpark $4,000 to $5,000, and total tooth replacement, upper lower 6 implants per jaw. I mean, that's $60,000. So
Yeah.
Wow.
it's
It's expensive to
it's-
have a nice set of teeth.
it's expensive. It's an investment though. It is.
Yeah.
One of my mentors when I was first out of school, he was a gum specialist. He was a periodontist, and he said as you age, he's like, there's really he called it the 3 M's that are going to really affect your quality of life as you get into the latter years of your life. He's like, your mind, your mobility, and your mouth. He's like, if you have those 3 things,
Mhm.
you're golden. You take any one of those 3 things
true.
away, he's like, you're screwed.
Right.
Yeah,
So I
that's,
kinda-
that's a
Kind of
good
carried
point.
that with me, and we sort of use that with our patients. And we talk to our patients that are younger, and we kind of see these things kind of creeping up on them. Just want to like avoid getting them to that point that, I think a lot of patients, either their parents or their grandparents had dentures at some point.
Well, I was just gonna
Right,
ask.
right.
Do you see like a lot of dentures?
We
like,
do.
will Chris eventually get dentures? Versus him? I'm sorry.
You have all the acid
Didn't we
reflux
talk about
issues.
HIPAA stuff before this conversation here?
I
But
think she'll have dentures
Yeah,
before I do.
yeah.
You're older than me anyway, so
10 months.
well, it
So-
makes a big difference.
but the thing is like nobody really wants that for themselves now. And I think previous generations just thought it was like,
They just
if I live long
accepted it.
enough, it's just inevitable. So
Right,
nowadays
right.
we have many of our patients who are in their 70s, 80s, 90s. They're getting to this point and they're like, they don't want to go down. They don't want dentures. If they want dentures, they want implants to kind of help them kind of
Yeah.
stabilize their
Right,
teeth.
right.
Do you know, I just read a biography on George Washington, and he had a lot of dental problems. And I
Mhm.
guess it was a thing back then for poor people to sell teeth to the wealthier
Really?
population so they could use real teeth.
And how did that work?
I wasn't there. I don't know.
You
But it was just like interesting,
Yeah.
the kind
Yeah.
of dental problems this man had.
That is interesting that they
It
sold
was a
teeth.
really good
Wow.
book. Yeah.
Wouldn't have thought of that about that, actually.
Yeah. Yeah, he had
So-
quite a lot of problems.
Mm.
So can we talk a little bit now about just gum disease in general and what things you can do to prevent it other than seeing you twice a
Right.
year?
Yeah. No, absolutely.
Floss.
Yeah. So I would say like a majority of gum disease is preventable. So brushing twice a day, flossing properly, ideally not with the floss picks. Listerine mouth rinse is actually very good for gum,
Nice.
not so much for cavities. Although I think they do make one that has fluoride in it now, like a marketing thing. But just like the general Listerine is great for gum health. So those kind of things, just, coming to the dentist twice a year, all the stuff that most of us sort of already know about. Now,
Right.
with that said, there's still going to be a subset of patients out there who the amount of the gum disease causing bacteria, maybe the type they have, is more aggressive.
Right.
So we have some patients, unfortunately, who have excellent oral hygiene, are doing all the things they need to be doing, and still have, let's just define gum disease. Gum disease is basically when you start to lose the gum tissue and jawbone, irreversible loss that supports the teeth. So you're getting to that point where you're looking at the x-rays, you're seeing you have less bone and the pockets around your teeth are getting deeper, your gum tissue's bleeding. That's sort of how we diagnose gum disease. Now, there's some
that
patients.
stinks if you're doing everything right.
Yeah, some people are just.
So then what do you do?
Yeah, so for those patients, we see them more frequently. So we know that the bacteria that causes gum disease, if we can clean it out of the pockets, get it below a certain level, we'll kind of help keep that at bay.
Okay.
We recommend seeing those patients 4 times a year, so every
Okay.
3 months. And some of the
Okay.
patients that are even on the more severe side of that, we'll actually work with a specialist called a periodontist to kind of what I call share the care. So they'll
Yeah.
see me, they'll see them, they'll go back and forth every 3 months, sort of indefinitely.
Just gonna give you a message too from our producer that says if you do send us some pictures that he'll put them in the
Okay.
show notes because you were very descriptive on some of your things. But if anyone does want to see pictures, we have the ability to post those
perfect.
in our
Awesome.
show notes for that too. So the other thing I wanted to touch upon is you had talked a little. Hey.
Sorry.
You had talked a little bit about obstructive sleep apnea and the link between oral and systemic health. Let's talk about that a little.
Yeah,
Let's
that's
do
a
it.
great topic.
Yeah, of course. So this is something that's, I've been aware of since I was in dental school. But there was it was one of those things where it wasn't really taught to the generation of dentists prior to that. So you kind of had to go out on a limb and kind of get your own education when it came to that. And there, unfortunately, is a little bit of a barrier between us and our medical colleagues, and especially when it comes to insurance, as far as like how to navigate getting a lot of this stuff sort of covered and paid for. So to kind of take a step back here, there's obstructive sleep apnea on a very basic level. It's essentially when you stop breathing. There's some sort of obstruction, whether it's nasal or in your pharyngeal airway space. You stop breathing at nighttime, and it's defined as like an event is when you stop breathing for 10 seconds.
Okay.
And there are some hallmark dental signs that we can see that make patients kind of telling a story, if you will. And obviously, there are patients that you think of obstructive sleep apnea. Might think of a middle-aged male who's a little bit heavier,
Right.
who has a cocktail or two before they go to bed at night. Big thick neck. But then there's also, I've seen women in their 40s who are like rail thin, who have obstructive sleep apnea. So you can't just, look at only that subset of patients. But from the oral side, two things we see. actually, well, three things really is oftentimes we'll see patients who have a very large tongue.
Okay.
Like it's so large that it's actually physically covering their lower teeth.
Oh. Okay.
And the side of their tongue will be like scalloped. So like the teeth
Yeah.
are like almost pushing it in.
Okay.
So we see that quite a bit. We'll see patients that are really heavy clenchers and grinders at nighttime. Like they will just be wearing those teeth down like mad. Like virtually no enamel left on the top of the teeth. It's all that inside melty like chocolate dentin. And then the third thing we'll see a lot of acid erosion. So a lot of these patients have what we call like silent GERD or silent gastroesophageal reflux, where I almost like I'm arguing with these patients, like, no, you know, this is what's going on. I don't have that. And then it gets into this like kind of adversarial thing, and you take a picture of it, and it's like, oh, okay. So,
I was just going to ask you what that conversation is like, and then what are their next steps? Like for that rail thin woman that you're like, hey, chickadee, you know?
Yeah. So
CPAP.
Yeah. So, you know, I'm very much like I'm not a physician. Like this is a medical problem and it requires a medical diagnosis. So fortunately we've got Dr. Gupta in Somerset, who's fantastic. He's right down the road from me. So I'll, you know, refer patients down to him, or, you know, some patients want to see their primary first and then get referred over for a sleep study. So the first step is a sleep study just to come up with a diagnosis. From there, you know, there's certainly some things as far as lifestyle things, work on your sleep hygiene, you know, those kind of things can be very beneficial, losing weight, you know, et cetera, et cetera. But a lot of these patients, that alone won't be enough. So, you know, I don't want to step on Dr. Gupta's toes, but oftentimes a CPAP is really the gold standard for most of these patients. There are some other treatment options out there. Some patients are CPAP intolerant, where they get claustrophobic, they can't wear it. There is a dental kind of appliance we can make for those patients. But it's like CPAP is like considered the gold standard, kind of essentially always where we start when they need therapy.
You know, I didn't realize how comprehensive dentistry was. You maybe did because you're a physician, but you really touch like a lot of different things that I didn't think about really past just the mouth and what you're doing when I go in for my visit. But you kind of have eyes like really all over, right?
Yeah. It keeps it interesting though too, from my perspective. I mean, if it was just, you know, what most people think about, they just put a filling or crown, take a tooth out, poke me around. Right. You know, it's not a lot of career longevity when it comes to that. So it does keep it interesting that there is a lot going on here, and we can kind of work with our medical colleagues to.
Yeah, you can see a lot of things that once again lead you to other diseases just by looking in the mouth and. And then there's this whole association between dental health and heart disease too, which I find fascinating that patients often don't know about. Right.
Yeah, they've taken atherosclerotic plaques, from cadavers, and kind of, basically you looked at what kind of bacteria is existing inside of there, culture this, and they found that the periodontal pathogens that cause gum disease they're there. And there's a lot of that there. So it is, it's a whole inflammatory cascade that kind of, I wouldn't, I'm never going to go as far as saying, gum disease is going to cause you to have a heart attack. But it's a synergistic kind of effect that's going on here. And it's more than just the high blood pressure. So
it's definitely important to attend to, though. I mean, it's definitely a risk factor.
Of course. Yeah, totally.
So, which is, I think, a risk factor many don't know about. They think about their high blood pressure and their high cholesterol and family history, but this is something that can be easily taken care of.
Yeah, absolutely.
So talking about some medications, what are the important medications for you to know about? So
I will say when first thing, just kind of a blanket statement here is, when you go to the dentist, it's good practice if you can bring all of your medications, and hopefully it's not that many. But if you can bring, if you have a card, or bring a copy of your most recent history or physical, can always be very helpful, that we can kind of get that scanned in. Because I think in general, patients don't totally realize how important some of these medications are. So kind of taking a step back there, if we want to kind of touch on the ones that are super duper important. Obviously if you're taking any medications that make you prone to bleeding, any anticoagulants, the Coumadins, the Xareltos, the Plavix, all that stuff is super important. If we're doing any sort of oral surgery, dental implants, I mean, that's just crucial that we know that. And oftentimes we're not taking patients off of these. Okay. But it's good to know, especially if you're on multiple ones, You know, that's really where it becomes an issue.
Right,
You know, multiple
right.
anticoagulants or post-cardiac event. Some that are people don't think quite as much about is what's becoming more, people know more about it now, but the bisphosphonates. So patients who are on anti-resorptive medications for osteoporosis, there can be some contraindications to, you know, dental surgery, and you're on those, or just some risk factors you need to be aware of.
What are some of those names, those drugs?
So the
Like
Fosamax,
Fosamax, Actonel.
yeah, and really the ones, the injectables, the
Those are the big
infusions,
ones.
the infusions are going to make these patients much more prone to developing complications after
Okay.
dental surgery. The Fosamaxes aren't, it's like a fraction of 1%. So we're not too worried about those.
Yeah,
So those medications can be very important. The SSRIs for depression, there's actually a fairly strong link now between some dental implant complications
Oh,
and those medications, which wasn't even on our radar
right,
3 to 5 years ago.
right.
So, like I said, we're not taking patients off these medications by any stretch. We're just sort of letting them know, hey, like,
Right.
we do this procedure, you need to know that there is this inherent risk, or you might be at
Right.
the success rate of an implant takes a little bit of a dip if you're on these medications.
Good to know beforehand.
Exactly.
Definitely.
So those are the ones that really crop up in my mind. And then there's just conditions that are just good to know in general. Like if you have any, you know, any chronic liver conditions,
Yeah,
are good to know can really affect bleeding as well.
of course. So, what are considered like dental emergencies? Like when someone's sitting at home and they're like, "Oh no," you know, like what are kind of some of those "oh no" situations that you should be getting a call for that
Right, right.
maybe someone would wait and you're like, "Oh no, why did you wait?"
Yeah. So I would say it's a spectrum. Okay.
Of
So
course.
what one person considers an emergency, the other person, they could be like,
Yes.
you know, for them, like showing up at the hospital with their face swollen out like a grapefruit, they might not even think that's important. And somebody who has a sensitive tooth might be like calling me at 2 a.m. on a
Yes.
Saturday night.
Yes.
So, so that's first thing. So I would say in general, you know, if you ever have like swelling, you know, in and around your mouth, if you have a fever, difficulty swallowing or breathing, like those are serious dental issues that
Okay.
you might not even want to wait till Monday morning to go see a dentist. You know,
Yep.
you know, you might want to go seek attention right away.
Right.
So that's you know, anytime I'm speaking to somebody on the phone over the weekend, just trying to triage that, that's kind of the first thing I'm asking them. Can you breathe? You know, can you swallow? Does it hurt?
Right.
Do you have a fever? Are you swollen? They cross all those things off their lists. It's likely something we can wait, you know.
Yep.
The second thing, if we're talking about things that maybe aren't quite as significant, if your condition is kind of achy, throbby, it's occurring on its own and it's lingering, it's probably more significant than if you have something cold to drink and you get like a little twinge and it goes right
Yes.
away.
Yes.
So the achy, throbby, lingering, spontaneous, keeping you up
Yeah.
at night, almost like a pulsating,
Yes.
more of an emergency than,
Okay.
you know,
Good
more
to
of
know.
a sharp sensation, kind of nervy, goes right away. You have
Yep.
to provoke it. Those are
Yes.
two
Okay.
different kind of pathways I'll talk to
good to know.
patients about. So, so yeah, that's a good general guideline. You know, like a true emergency where I will like go in after hours and see somebody is if they have trauma. You know,
Of course.
they fell, their tooth came out of their jaw. Like those are situations where I can go in after hours. I can sometimes replant the tooth, kind of splint it together to the adjacent teeth.
What? Wait, I didn't know about this.
Yeah. So the next bar fight
And
you
you
get
knew
in,
about
when
this
you
too?
lose your tooth,
I don't lose.
you can be implanted back.
Really?
Yeah,
It's like a finger. You sew it back on. You just
Yeah,
grab
you
the
just-
absolutely.
tooth
Yeah,
and you-
totally.
Yeah.
Yeah. It's happening.
Ooh,
As long as
Yeah.
you do it quick enough.
Yeah.
Really?
Yeah.
Do you have to put it on ice?
No, ooh,
No?
that's a good question. No, absolutely not. So,
Just wrap it up and run?
so ideally, you do it yourself, and like you
Oh.
put it back in the socket until you can get to see me. Now, if that freaks you out, or you're afraid you're going to put it in backwards,
Be at your house. Put
which
this back.
something you might do, Nancy, put your front tooth in backwards.
Yeah, that would
Yeah.
be weird.
is
Definitely.
you can put it in milk. That's sort of thin,
Really?
sort of something you can do,
Really?
but definitely don't rinse it underneath water.
Don't leave the glass of milk out on the
Yeah.
table.
2% or 1%
Whole
or
milk.
whole.
Yeah.
Whole
Yeah.
milk.
Whole milk.
Whole
For sure. Yeah.
Not the oat milk.
All the fat.
Not oat milk.
Yeah.
Not oat milk. No, too many carbs. Don't do oat milk.
Oh my
But yeah.
God.
So yeah.
Actually, oat milk. might
And next
have
time you
less
get in that
carbs.
bar fight you lose,
Wow.
just put it back in there.
Actually, it's pretty
Yeah.
tough. She doesn't lose her teeth too much in those
Yeah.
fights.
Try not to. Try not to. So speaking of teeth and milk and whitening, you see how I
Yeah,
made
we
that
talked about
link?
whitening a little bit, but
What's the best way to whiten your teeth? And is there any like risk or danger? And people talk about sensitivity when they're whitening their teeth. Can you talk about what you do in the office versus what you can go buy at CVS? And
Right. Yeah. So first thing I'll say is what you buy at CVS works. What we do in our office works. The biggest difference is kind of the concentration of the bleach
Yeah.
that CVS
Time
can sell
frame.
versus what
Yeah.
we can do. It's like
yeah,
OTC, over the counter, versus prescription strength.
yeah,
As we're doing in our office, it's kind of supervised. We can do a
Mm.
higher concentration. We can achieve it faster, I guess, if you will.
Yeah.
So that's kind of really the big thing. As far as the sensitivity is concerned, some patients, especially if you have a lot of that exposed dentin we talked about, you're going to be more prone to sensitivity. Now, fortunately, nowadays, the bleach we use in our office, it has fluoride and it also has the same stuff they put in Sensodyne toothpaste. Potassium
Oh,
nitrate is built
nice.
into the
Okay.
compound.
okay.
So that kind of helps
Decreases it.
decrease it. Oftentimes, we'll tell patients that have a history of having really sensitive teeth to use Sensodyne like 2 weeks before, just to kind of, maybe take a little ibuprofen before they come in. Rarely is it an issue, though, even patients who have a history of like really sensitive teeth. So yeah, that's been a huge advent. I mean, prior to that, it was like sensitivity was just rampant. And
Right, because I remember having trays done like 15 years ago, and then you would buy the little syringes filled
Right.
with the bleach concoction. But after like the first 3 nights, it got like really
Right.
sensitive.
Yeah.
Does that not happen anymore?
it happens to a lesser extent, and it's
Okay.
not quite as intense as
But
it
is that
used to be.
injuring your enamel on your teeth?
It's not at all. So
No? Okay.
yeah, and there's actually some studies out there saying that using bleaching products can actually decrease your incidence of tooth decay.
Oh.
Really?
So
Okay.
not that I would ever like tell patients, hey, like just like go home and just bleach your teeth every night to like not
Mm.
get a cavity ever again. But there is some research out there showing it can actually have a
Ah.
beneficial effect against tooth decay.
Interesting.
So
Now, when you have, is it laser treatment for whitening? Is that the correct term?
we do have that in our office.
But you come out like super white, glow in the dark
You
white, right?
come out glowing the dark white when you
Mm.
come out of the in-office bleach. Now,
Yeah.
I always tell my patients, like anything, if it happens that fast, it's probably too good to be true. So it's great if you're getting married that weekend.
Yeah.
Sure.
And you want this, like you come in on like a Wednesday or Thursday, you're getting married on Saturday, like good on you.
Okay.
But like 2 weeks later, your teeth are going to kind of be back. I wouldn't say where you started,
Really?
but it's
Oh.
going to be a pretty
So it's
dramatic
really
rebound.
temporary.
It's really
Okay.
temporary.
Okay.
If you want a longer lasting bleach, you're going to have to do a little bit of the effort at home, like you alluded to, with like the trays and like the syringe material. You're going to do it for maybe an hour a night for like maybe a week or two. I always tell people to bleach a little bit more than they want to, with the understanding it's going to rebound back a couple shades like after a
Okay.
few weeks.
Then how long? So if you do that for 2 weeks, then how long does that last? So it's significantly more than your
I
baseline.
would say in general, 6 to 9 months is a good
That's not
Okay,
bad.
that's not
baseline.
bad.
Yeah.
Now, I
Yeah.
mean, if you're drinking like 3 glasses of red wine every night, having tea,
Not anymore.
a soda, coffee throughout the day, you might want to, you're going to cut that time like in half.
Yeah,
It all kind of depends on like what you're putting into your
You
body.
drink a lot of tea.
I do drink a lot of tea.
Yeah. You're not a coffee drinker, though. I don't.
I'm not a coffee
Yeah,
drinker. I'm a
me
tea
either.
drinker, which is probably worse.
Yeah. Well,
But
for your,
I don't know. Is tea worse than coffee?
for staining
Yeah.
or
For staining.
it depends on what kind of tea you're drinking.
I could do it like shots.
but-
Do tea shots.
Yeah.
Like miss my teeth.
I think the joy. I'm going to say they're both about the same.
Both about the same. Okay.
Yeah.
All
Which
right,
is code
great.
for I don't know.
I like that.
So that's good information on the whitening.
Yeah.
Looks like I'm going to be calling your office tomorrow. All right. Then I think, do you have any other questions? I know that you are accepting new patients, right?
We are, yeah. Yep. We have, like I said, we expanded our facility a year ago. So we do have some open capacity right now.
That's
so we are
great.
seeing new patients. And
Nice.
yeah, we love
You have
seeing
other
new
dentists
patients.
with you there?
We do, yeah. Right now we've got 3 dentists.
Mhm.
We've got actually a 4th one joining us in
Nice.
January, and
That's nice.
yeah, which is good. So, yeah, my kids are they're 4 and 6. They're kind of at that age
Oh,
that
they're
it's
little
like
babies.
it's just like they're babies, but they're getting to be a lot of fun right now. So,
Yeah.
kind of like cutting back slightly. I mean,
Yeah.
I love what I do, and I'm gonna be
No,
doing
kids
this,
grow up
but
so
yeah, but
fast.
I'm trying to when they're at this age right
You
now,
need
I'm
that
gonna just cut
balance.
back just a little bit so I can spend some
Yeah.
time with them. So
Mm.
while they
Nice
still want to hang out with
dad.
me.
Nice dad.
Until they're teenagers. And you can
Exactly,
go
yeah,
back to
'cause I-
working.
Oh yeah,
80 hours
full-time,
a
80 hours a
week,
week.
yeah,
Yeah, for
yeah.
sure.
It's true, though,
Oh
isn't
my
it?
gosh. So what is your contact information?
So, so our practice is in Somerset, 863 County Street. Our website is smilesomerset.com.
I love that. That's
Yeah,
so
it's good.
cool.
Yeah, I'm just glad it was available at the time. I kind of felt like hit the
Yeah.
lottery with that.
Oh my God.
Yeah, the phone number's 508-674-4556.
Excellent.
We'll
And,
post that also.
Yeah, totally.
Yeah.
And yeah.
Definitely. And then lastly, what is the one message you would like to give to our listeners?
Ooh, the one message.
The one message.
So the one message is like, dental care doesn't have to be scary, and it doesn't have to be complicated.
Yeah.
If you haven't been in a while, like there's not a single dentist that's going to pass
Yeah.
any judgment on you. It's like just showing up at the door, and just you got to start somewhere. It's always cheaper, less expensive, and less painful to address problems earlier on in the process
Right.
than later. So yeah, I mean, none of us are perfect. None of us make perfect decisions all the time. I'm a
Yeah.
human just like everybody else. I've had dental problems myself.
Yeah.
I've had cavities. I've had a crown. I've had a tooth extracted. I mean, I've been there. So
Yeah.
although from the outside looking in, it might look like all my teeth are perfect. I mean, I'm just like everybody else out
They
there.
do look
and-
pretty good, by the
Yeah.
way.
They look really
so-
nice. I've been checking them out.
I would say my wife's an orthodontist in Swansea,
Oh, okay,
so I
okay.
kind of got a little like
Yeah.
I did the
there
whole
you go.
Invisalign
I
thing a couple
see.
years ago.
Yeah.
I have
I
like
see.
a little bit of an unfair advantage when it comes to
Oh, I
that.
see.
So, but yeah,
See how
so,
that goes?
yeah, that's pretty much it though. I mean, I
So,
see
yeah, go-
patients all the
Go
time,
early,
and I
basically. Don't be afraid to go.
don't be afraid to go. And I would say like as far as like what I do, it's not even so much of like the technical aspect of it, but it's like kind of like that experience you had when you came to our office the first time. This
Yes.
is kind of refreshing, like
Yes.
because when
it
you do that
really
for somebody
was.
and then they come back consistently 6 months, like
Yeah.
indefinitely, like that's really the stuff that moves the needle. You
Yeah.
know, it's not all the technical mumbo jumbo because, we spend 2 days a year with the average patient. The other 363 days a year, like they got to go home and do it themselves. So
Right.
like, it doesn't really matter what we do those 2 years. I mean, obviously we want to do a good job,
Yeah.
but like educating them, empowering them to make the right decision, that's what's going to move the needle. So
Awesome.
that's my message.
All
Great.
right. Thank you
Awesome.
so much.
Awesome. All right. Well, I want to thank Dr. Vanderpool. I want to thank you, of course, for coming on to our show today. This was great. I learned a lot.
Me too.
Yeah.
Especially about when I get in the bar fights.
Yeah, I know. You got to be careful with that going forward. But, we don't learn a lot of dental.
No, it was
in
really
medical
exciting
school.
to have a
It's-
dentist on today because there's a lot.
Well, thanks for having me.
was
I
great.
appreciate it.
That's
So
great. And I want to thank all of our listeners for watching our show. And if you'd like to become a sponsor, please contact us at 774-319-4230. Special thanks to Ron Gamache for our intro music and the BioSkills of Northeast for producing our show. And of course, Bay Coast Bank, which is just right for all of your financial needs. Visit baycoast.bank or call 508-678-7641 to learn more. Thanks again for being part of the show.
yeah, thanks for having
Really
me.
appreciate it. It's great.